Good evening, everyone, and thank you for joining us again for the third week. As a reminder, please note that participants' microphones are muted during the speaker's presentation, and webcams will not be used in this call. So to participate in the discussion, you may type your questions or comments in the chat box. May we now call on Sir Siddharth to begin the training?
Thank you, Cha. And also from my side, welcome to everyone who's joining us today. As I mentioned earlier, this is this series of capacity development trainings which we've organized from the side of the openIMIS initiative. I am Siddharth. I work at the Swiss Tropical and Public Health Institute based in Basel, and I work with the initiative to on these capacity development resources that we are developing. So this training is also part of that. The first two sessions that we had, the first one started with essentially a broader overview, kind of looking at the broader health financing context, then drilling down into specific health financing mechanisms, and then specifically around health insurance. We talked a little bit about transactions to just understand where digitization needs come in. And then in the second session, I started really going into openIMIS and explaining more functionality. So session one was really around access, on how to create access in the system, location configuration, etc. And now today, I will be talking more about the remaining bits which we need to configure in openIMIS in order to sort of construct a scheme before you start doing any kind of transactions. So in the last session, I will focus mainly on transactions. So how do you do enrollments, claims, etc. But today I'll try to complete the remaining part, which I started from the first session, which is really the construction of a insurance scheme. We had created these sessions with certain audience in mind, which has slightly changed. So the idea initially was to talk now about how to run a demo, where the understanding was that people understand a little bit already about openIMIS, and it was more to talk about ways in which you can do it in an easy way, that it's easy to grasp and to show different functionalities. But I have modified the session a bit, so we will try to go into details of some of these configurations, and that's where we'll also try to do some hands-on activities. So this is an overview of the overall session. So this includes what I do today and next week. So I'll start right now, as I said, with the so-called construction of a scheme. So I'll stay on the first 2 points today, and the rest of these processes, this is what I will cover next week. How we will run the session now, as before, we've tried to make it a bit interactive, and today we will not have any polls or so, but we will really do some hands-on as well. So I've broken it down in this particular way. So I'll start with section 1 and 2, as I said initially, then show you on the demo server how some of these configurations are done, and then stop briefly to let you all have a go at it. I'll give you a small task as before, and we'll ask you to then log in to the demo server that we have, and practice basically the task that I give you. Then I will briefly again cover all the registers I'll cover in 2 blocks. One will be all the registers, and the last one I'll take a bit dedicated time on is the product configuration. And then again we do some practice round, and then after that whatever questions we have, we try to answer them at the end. But as Shah mentioned, please do type in at any point if you have questions into the chat. All right, so the first part then, overview of data flow. If you were there for the last session, you would remember this diagram from there, where I was trying to explain a little bit how data flows through the system, so how communication is happening, mobile phones, offline bits, etc. But I had emphasized quite a lot on this, on the fact that the application is really placed, it's a web application placed on a central server. So even though some transactions can be done outside of the server, so on a mobile phone, offline or so, some things are important to do on the server. And a lot of what I talk about now, that is the reason why it's important to have it on the server. So in any kind of scheme that you have running, let's say a health insurance scheme, you might have at some point a new health facility which is joined. So you would need to then update this in the configuration of the system, and then create accordingly users, etc. And hence a user from that health facility obviously cannot enter anything on the phone if this is not updated on the central server. So what I talk about now, all of these things are just done on the web application, these configurations. And now I'll go into a bit more explanation of what these configurations are. So that's the construction of the so-called construction of the scheme. This again was something I showed before, where I talked about different transactions across these three blocks: the purchaser, the provider, and the client. What we did in the last session was a lot around, if you remember, locations and accounts. So we created user accounts. So these are different people who are then part of the structure of the purchaser as well as on the side of the health facility. So who's supposed to undertake certain tasks. That's what we talked about in the last session. Now what I talk about is the construction of the scheme in the sense, so let's say the provider side. On the provider side, you have health facilities which will offer, which are so-called empaneled in the insurance program, and they have to offer healthcare services to clients based on certain conditions. That was these contracts, which were somehow encompassing and all the conditions which are applied between the purchaser and the provider. So firstly, we have to create, of course, health facilities. There are different types of facilities which might be there: dispensaries, hospitals, referral hospitals, high-level care, etc., tertiary care, etc. And you might also have not just by different, but by type. So you might have, let's say, a dispensary, which might be a public dispensary run by the government, or you might have a dispensary maybe which is run by a charitable organization or a private organization. So these are all different kinds of health facilities which are so-called empaneled, which have to be added to the system, and that's part of constructing the scheme and the system. You then have also the so-called services and items which are offered by these health facilities. So services meaning, for example, if you do a consultation with the staff, perhaps the price is a service which is offered. And an item would be a commodity or so. So for example, drugs, you might have paracetamol X units which are given at a particular price, etc. So this is the definition of what I call here services and items. And then since financial transactions are also happening, it's a system where money is also exchanging. And so price list also is created in the configurations of openIMIS. So what facility is offering what kind of services and items and what prices? That's basically, in a nutshell, some configurations which are related to the providers, which is done. And then you have, of course, all the conditions which are applied to the client. So the purchaser perhaps offers certain coverage. So all these services are covered at a particular price, but maybe it says you cannot benefit more than 100,000 a year or so. So there are different limits which might be applied to an individual. So this is what is then translated into what we called also sometimes registers. So that's what you have to configure in openIMIS. What we did in the last session is all here. So user profiles, users, enrollment officers, claim administrators, and locations is what we did last time. So what I will now talk about is payers and all these other registers which have to be configured. And they are all linked with example. Payers essentially is a third-party payer who might pay on behalf of a particular family. So this is a configuration that we do, and at the time when you do an enrollment, it's just to indicate that the payment for that household comes from a third-party payer, an external payer. That's what we mean by payers in our configuration. Then we have what's called diagnosis list. So this is essentially how do you categorize a particular treatment. So you have made an assessment on an individual, categorized it as XYZ disease, and based on that you have given certain services or prescribed certain drugs or so to that individual. So this provision of services and items. So that's the diagnosis list which we talk about. And this can be specific to a particular context. So this can be maybe some countries apply ICD-10 codes, 9, version 9, and according to that, this diagnosis list can be added. So the system doesn't prescribe what you need to do, you can indicate to the system what classification do you actually use. Then there's the bottom part. So we first start with so-called medical services and medical items. As I explained before, services and items, the definition is the same. What kind of services are offered, or drugs or other commodities are offered, categorized as services and items. But here we first create a sort of universe of all possible services and items that can actually come into openIMIS. So that's the first part to really create in IMIS, medical services and items. Once that's done, we then create price lists. So price lists right now it can be specific to a health facility, but generally this is specific to a category of facilities, which might follow the same kind of price list. So you can have maybe 10 health centers which follow one price list. And that's basically what you can configure then here. You can also have 10 facilities following 10 different price lists, and that's fine. You can do that here. So price list basically would then be a subset of your services and items. So for example, you might have 100 services, but then at the level of a dispensary, perhaps you only have, let's say, 20 of those services which are offered. And that can then be part of a price list. So what you're creating in a price list is a subset of your services and items. And that price list is then linked to a health facility. So as I said, you can then create, depending on how many health facilities the insurance scheme has empaneled, all health facilities can be configured here and then linked to a particular price list. This is then defining a lot of the relationship of the transactions between the health facility, the individual, as well as a health facility with the insurance scheme. And what you have in products is the final overarching connection between what the insurer offers to an individual and what arrangements are done then with the health facilities. So in products, you will finally configure conditions which are applied to individuals, as I said. So you really put down what kind of prices are applied, if there are grace periods, etc. And then on the other side, what kind of things are covered by the coverage by the product, this product which the insurer is offering, all kinds of services, items, etc. So this is just an overview. What I will now do is I will actually go to the demo server now and give you a quick explanation of how this looks like. So I hope you're able to see my screen now, and I'm on the demo server. So you will also have this in your task. This is the demo.openimis.org website. You log in there. The logging bits is what I covered last time. So right now I'll go straight to the descriptions which I gave now of different registers. So these are all under administration. So I started with payers first. So as I mentioned, payers is a third-party payer which might pay on behalf of a particular household. So there's one example here. You can always add, feel free to play around with it. I'll just use added bits here so that there's some data in there and it's faster to explain to you what it is. So here it's essentially just some identifiers of this third-party agency, some details to contact, etc. If they have some regional scope, perhaps they don't offer anything outside, so you can leave it blank. But in this case, they have a specific regional scope as well, which can be indicated. So that's really this third party payer. And the other small element to quickly show you is what's called the diagnosis. So as I mentioned, the list of diagnosis. This list can, there's a particular format which can then be updated, and you can upload this list here of diagnosis. We don't have an interface where we go step by step, because generally whenever diagnosis categories are added, these are coming in huge clusters. So you have perhaps the ICD-9, some in Tanzania, for example, they applied ICD-9 at the beginning and then switched over to 10. So it's a big list which has to be uploaded. So the entry point into the system, we kept it this way, where you have a file, an Excel file in the respective format. You then upload that particular file into the system. And you have some smaller things here. So for example, right now there is a list. So if you see here, diagnosis, there is a particular format, as I said. This is the existing list which is already in the system right now. So diagnosis codes, description of it. So something exists, and now you might want to perhaps add to it or update it also. So this is what you see under here. It's just to indicate how you want to treat this new list which goes into the system now, if an existing list already is there. There's a possibility to say what's called a dry run, which is just to see what will happen if I actually update this in the system. So you can see the results before you actually deliver these changes then on the online system. So this is around, this is what I mentioned around registers for diagnosis, or uploading diagnosis list. Similar logic, locations, health facilities, we do have an interface here to go one by one, but if, of course, if there's a large number of cases which have to be entered, there's similar way you can enter it using a kind of bulk upload here. So these were 2 bits, and then were the related bits which I wanted to talk about, which was which I described before, which was the medical items, medical services. So items and services. Now this is the full universe of all possible services and items which can come into openIMIS and have any transactions there. So as you see right now, there's about 81 services. You can add more to it. I'll just open, so this add button here, you can add to it, edit, etc., delete. I will just open one of these to show you also, as I said, some data in there. So what information we capture is, of course, some identifier, so a code, a description, a name of that particular service, and you'll find a very similar configuration way also for the item. So you then indicate whether it's a preventive, curative care. These categories are very specific. So when I come to product configuration, I'll explain what this is. The level here is just to indicate whether it's a simple service, visit, day of stay, or hospital care. Price is what we call the base price. So this is the starting point that we say, perhaps this is the general price which most of the facilities will apply. But of course, this can then be overruled later, depending on what negotiation was done and what kind of arrangements are there with which health facility. You then indicate the type of care, whether it's inpatient, outpatient, or both, as well the frequency. The frequency basically indicates what is the time period within which you cannot offer services again, the same service again or item again. So if it's 5, it means within 5 days you cannot have another, in this case, a general consultation, for example. So you can create these kind of conditions if they make sense, and otherwise leave it as it is here. The patient, so what type of patient can actually avail these services? Man, woman, adult, child. So there's some of these conditions which can then be applied, and accordingly later when the claim gets scrutinized, these conditions are also applied in the same way as per your configuration here. So as I said, you'll find the same under items. So I will just quickly go now to medical services price list. So as I said, we've created now, let's say, a universe of all possible services and items that can come into openIMIS. Now we'll try to create something which is specific then to a particular type of facility or so. So here you see there's some configuration which are already done. So this is by certain locations. So we had 2 regions. So in that case, each region had a specific price list that they were following. It's possible you don't have geographical differences, and in that case, it's fine. In this example, there's a difference by geography. So 2 different regions follow 2 different price lists. And then within the regions as well, they have different price lists for different types of facilities. So there's only government facilities here. So government facility at the level of a hospital, health center, dispensary. So here again, you can add using this add button here, but I will just open an existing one again to show what it looks like. So again, some identifiers. So what is a name with which you can identify this price list, a point from where this this price list comes January 2018. If you have a regional specification or not. And then here what you see is the full list of services. So as I mentioned, the so-called universe of show here. And you can then pick and choose what exactly is part of this particular price list. So in my case, I have a regional difference. It's a government facility and a dispensary. So here, perhaps they are only offering 4 out of the full list of services. So this is how you can create a price list allocated, which you will later allocate to a health facility. So this is how I did the service, and you'll find it exactly the same also with medical items price list. So you get a cluster of all items, and then you put them together to create a price list. And the last part here is really how you relate this to a health facility. So you are now creating a health facility, and then you will allocate a price list to that health facility. So here again, you see there's quite a lot of 15 odd health facilities. Depending on your scheme, you have them configured. And when you create a new health facility, you obviously have firstly the location. So where is this health facility actually located? What form, let's say a private or so, what level. So you have these levels here that you can configure, let's say a hospital, sub-levels in case you need that, the type of care. So if you remember before with some of the configurations, you were indicating what services and items, in what setting are they actually given, inpatient, outpatient, etc. So similar way, you can also categorize and indicate what the facility can actually offer. This is a code which you give perhaps to the health facility. So a unique way in which you identify this health facility. And accounting code is all payments related to that health facility. What code are they related to uniquely within the system? Hospital or whatever. Then there are some identifiers like address, phone, etc. And then the part which I mentioned, which was about what kind of prices do they follow? So what kind of services and items can they offer, and at what prices have these been agreed at? So you will see basically, so I've created a region here, and in that region, there were these 3 price lists which were available. And if you create more, you will have obviously more lists there. So this is how you will then allocate, let's say, a price list to on the side of services as well as on the size of items. And then what you see at the bottom, this is not mandatory. This is in one specific case where the payment mechanism is to a health facility is also tied to one parameter, which is the catchment population of a health facility. So only in those cases, this bottom part is used. So for example, you can indicate that this health facility that I've just created, let's say there are these 3 villages. So it has its catchment area is basically these 3 villages. And the whole population there is supposed to be part of the catchment area. So you just indicate 100 here, meaning 100% of the population of this village, which if you remember from the configuration which you do it in village, you can also indicate population. Then you're just saying 100% of the population of that village is linked to this, is the catchment area of this health facility. So it just helps you in calculation of that parameter for the for that specific capitation formula. And if you, of course, don't use it, you can leave it blank. And you can then save here on the bottom right, the health facility. So this is how you can do the health facility, create a health facility in the system and link to it service and item lists. What I will now do is go back to the slides and basically talk about a small exercise now that you can do. So what we will now do is basically split you up into smaller groups and give you around about 10 minutes, and then after that you'll come back to the main session. And the task which I would give you and ask you to really try it out is, there is a scheme already existing. As you see on openIMIS, there's some demo data on the server. So now let's say you have a new private hospital in this particular Ulta region, which has now been empaneled. This will offer all available medical services and medical items. So whatever you have in the system, everything will be offered by this hospital, this private hospital. The only difference is that the negotiated price for medical items are exactly the same, but for medical services, these are charged 10% above the standard charge. So which means when you're creating the medical service price list, you can obviously use the same medical items price list because there's no difference in that. But for the medical services, there is a difference of 10%. So you would have to alter the, in the price list for this facility, you would have to make a slight difference of 10% as it's mentioned here. And maybe just to quickly go back to the demo server, I just realized I didn't show you this perhaps, but I will also show you very quickly how you can make changes also to the price list. So for example, you have a price list here, there's this overrule. So essentially you can create a new price list, and in the price list, you can add to the overrule here another 10%. So this way you can add and alter the prices and then save that. So that's just a hint for the task right now. All right, I will go back to this. I think you have already been shared this slide, so you should all have this task, and if not, I'll leave it here. And I would ask you to please go to the demo server and then just use the provided login there and try to make this configuration. So what I'm asking you to do is basically, you don't need to worry too much about adding new medical item services. As I said, everything is used. What I'm asking you to do is just create an additional medical services price list, which has this 10% additional amount than the standard amount which you see. Everything is offered, so everything in the system is offered. And then create a health facility and allocate this price list to that health facility. All right, Cha, could you put everyone into breakout rooms for 10 minutes? Perfect. I think everyone is back. I'll come back to the server and maybe just quickly look at, I hope you at least tried. As I said, I mean, it's not about making mistakes. So just please try it. The demo server is there for you to really play around with and add data. I had quite a quiet room, but I was looking at what you actually configured. So just very quickly, in the medical services price list, I saw that some of you had configured. So I'm glad at least a few of you tried it out. So as per the task, what I mentioned, you created some price lists. Let me just quickly go to that. So for example, I saw there's this Colombo, Harare. So as I said, I asked you to make a price list for this particular region. So what you see on the screen, these two, the first one, for example, you indicated a region, which basically means this price list is valid in the whole region. The second one that you created, you also specified a district. So it means only in that district of that region is this price list valid in. And that also is then reflected when you create your health facilities. So for example, here I saw a few people have managed to create a health facility. Yeah, so when you created the health facility here, the price list which you then add, that's basically, so according to the price list and the location which you created, you will have in your drop down here that particular list which is available. So right now, all of these are available in this district for this region. And then you can configure according to that. So this is basically exactly what I mentioned now. So in this case, you've added a price list that you just created. All right, then the last part which I wanted to cover was really around what's called products. And this is, I would say, the most important part of all the configurations which is done, and quite a lot. So I will use again, like I said, an existing one. So there's data already existing, but please feel free to add here a new one. So when you come to the product space, as I mentioned, it describes a lot of the conditions which are applied to health facilities, but at the same time also to individuals. So what you see here is, firstly, there's a lot of information, kind of identifiers for that product. What's important is to also indicate from what till what point is this sort of product in the market. And in case it finishes at a particular point, perhaps you have a revision, you have a new product which you revise, maybe a new price, maybe new benefits which are covered, etc. You can then use this conversion function. So as I mentioned before, with enrollment officers, you basically can convert everyone when you go beyond this period, and then someone who had a policy under this product and then tries to renew after the period when this product is finished, you will then automatically get converted and renew on the new product that you've configured. Then there's lots of configurations which are then applied to the side of the family. So for example, prices, are they placed as a lump sum amount irrespective of family size, etc.? Or it could be that you have amounts which are prescribed based on an individual. So maybe you also have differences between a child and an adult, the amount that they have to pay. So these can be configured here. There's can be thresholds on minimum number of people which have to be in a family in order for the policy to be activated, or perhaps there is a upper ceiling as well. In some schemes, they have a full kind of upper ceiling of maximum number of people who, for which you have to pay so much amount. And if it goes beyond, either they go into a new household, or perhaps some additional conditions are applied where maybe each individual, you can then have an additional amount which each individual has to be paid. So you can configure in this way. You can define the insurance period. So generally it's a year, but it can also vary. You can have insurances for longer periods as well. Administration period. So if there's a delay in starting coverage, how many installments, what criteria you place, are there grace periods on whether to do with payment. So in order to complete your payment, do you need a window of time within which it should be done? For enrollments, for renewals, is there any kind of grace period which you have? This really relates also to a sort of fixed time cycles. So fixed time cycles are essentially, some schemes decide, maybe because it's administratively easier for them to process, they don't have throughout the year enrollment. So you can't just come at any point and start at that point, but rather they configure what's called cycles. So you can say that perhaps in a particular month, so anyone who comes, say in the 2 months before this cycle or so, and enrolls, the start point for their coverage will still be the 1st of March, for example, as I place here. So the grace period essentially just gives you extra time so that you can still stay within the same cycle. And essentially your end point then is all coordinated. The whole population then ends at the same point. And the same way you have different discounts, perhaps on the amount that is being charged for renewals, for enrollment, and what period. So if you come 2 months before your actual renewal point, perhaps they give you a 10% discount or so. So these configurations can be done here. What you see here is now very specifically, if you recognize, this is basically the services and items which we configured before. So as I mentioned before, you have a so-called universe of all services and items, and that's basically what you again get here. And You have created a health facility, you have created what the health facility offers at what price, and here what you configure is what this particular insurance product by the insurer will cover. So it's possible it covers everything, it's possible it covers maybe a part of it and excludes certain services and items. But for each service that or item, a drug or so, as you see here, that you configure, you have further configurations, quite a lot of them, which you can add. So I won't be able to, in the event, because of time, be able to go through everything. But I would encourage you to, if you want to explore it really in detail, to look at the user manual, to also see what these are. But I will go very quickly through this. You can, at the level of each service or an item, also configure, for example, if there are co-payment amounts. So you could say, for example, for a consultation, perhaps the total cost of the service includes co-payment which the individual has to make, and part of it which the insurance scheme will cover. So 100% basically means 100% of the costs are actually covered by the insurance scheme. These can also be then split by children, adults, if there are different conditions in an insurance scheme. The ORE essentially just indicates E for emergency cases. So you might have a different co-payment rule for an emergency compared to a referral case or other cases, general walk-in cases which are coming in. You can also have limitations on the number of times an adult or a child can actually avail this service. Some schemes maybe say 10 times in a year, let's say an individual can actually avail consultation, outpatient consultation, or you can have waiting periods, again, different for adult children, where you can have ceilings. For an adult or a child. So there's quite a lot of configurations that you can really do at the level of a single service or a single item. Similarly, you can also have conditions which you can do on clusters. So for example, at the level of an overall treatment or at the level of an overall in total for an individual or a policy or say a family. And these conditions are similar. Do you have any deductibles, co-payments or so? Do you have any kind of upper ceiling? So do you have a total amount that you cap a treatment or an individual or a full household with? Do you have different ceilings for hospital care or non-hospital care? So these are now at the level of treatment individuals and households, whereas above what I explained here was at the level of each service and item. So there's these variations in conditions. Then there's also this very specific thing which one scheme applies, which is some limits which they have created for certain category of services. So consultations, for example, they put an upper ceiling on each event, and they also put in how many number of times you can avail this consultation service. So very specific to that scheme, they have created these conditions. Distribution is where we have something called a relative pricing concept. Here again in the manual, the detailed description is there. But in a nutshell, this is a different payment mechanism where you cap the total amount which can be paid to health facilities, and that's the cap comes from the total amount that you collect. And here you indicate the collection that you have over how do you want to distribute it over a period of time. And you can indicate that that amount will then get distributed over a period of time. And then based on the number of claims which are coming from those facilities, you can then distribute the amount to different health facilities. So the more you claim, the more you get paid. That's one form of mechanism, payment mechanism, which was applied in Tanzania, for example. Then there is the capitation system, which you have right at the bottom here. So here I mentioned they now in Tanzania, they moved to this kind of capitation system where they apply different so-called weights to different parameters. So they give weight to, they firstly indicate what part of the amount collected will actually be used to pay out using this capitation form. And then they give weightage based on population, or it could be families, so not individuals, but rather families. It depends on what they choose. And then also weightage on the actual insured population. So one is the general population in a catchment area, Then the other parameters is around the insured population in that area, because not all of that population might be insured. And then the last parameter is really around the visits. So how many times these insured people have actually made a visit and claimed. So based on the distribution here, so for example, 70% of the weights is only for the visits, maybe 10% on insured families and another 10 or whatever. Sorry, totaling up to 100, of course. You can then create this kind of a distribution as well. So this is then how payments will be done to healthcare facilities. And briefly, one small thing which I left out here was really some additional amounts which can be added, one-time payments, administration related, so not really with regard to actually paying claims, but perhaps additional amounts which might have to be paid. These configurations can also be then added here. So I will stop here briefly. I know I've run a bit over time, but I would ask you to perhaps do another quick exercise here, which again is in the slides which were shared with you before the session, but also I share it here. So if you can, please try to just add a new product now. And I've given the description here that a new product is introduced from today. If you can add all medical services items to it, it's valid for the whole country, so not one region or so. The scheme will offer a product at the price of 1,000 per individual, and each insured family is able to claim up to 200,000 in a year. So a very simple case. Standard rates configured in the system have been agreed between the insurer and facilities, with insurer covering 100% of the cost. So if you could please go back, Cha, maybe let's just do it for 5 minutes, and maybe you can keep the groups a bit bigger, 4 people or so. And if you could just give it a try and see if you can configure a product, and then come back after 5 minutes, and then we can wrap up the session. All right, I think I see numbers going up, so I imagine everyone is back. I'm sorry about the slight rush here. I was running a bit over time, so we had a shorter session, but I would please encourage you to also go back and keep trying it out on your side. I saw someone has added a product. That's great. And for everyone else, please do try it on the demo server with the task. If there's any question, just shoot, let us know. And at this point, I would stop perhaps. Cha, are there any questions that you see?
Yes, Sir Siddharth. So this one is from Dr. Chamika. Are there any APIs to connect multiple instances?
I mean, there is the API layer now being developed to make it more modular, to be able to interact with other systems. I guess your question is more if, for example, there are 2 insurers and they run 2 different instances of it for their insurance schemes, then we don't have a use case for it, but I would imagine they would also build upon the API layer where we talk about any kind of data transaction from the system to other systems. But I wouldn't have a use case right now to tell you where there's 2 instances, separate insurance schemes, which are then communicating in some way.
Thank you, Sir Siddharth. The next question is from Dr. Tin Minsue. Do we have to use preset admin account or individual account?
I think I answered. It was probably for that task, and it was just to say that please use the admin logins which are there for that exercise. So even if you want to practice it later on, just use the login credentials which you find when you land on the page.
All right, thank you. I think those are the only questions, Sir Siddharth.
Okay, I think there was one other thing I saw, maybe it was a comment or so, but just in terms of the format of the lists which are uploaded, it's XML. So there's also a wiki page on it. We'll also have a so-called training on we call it module 2. So I'm doing module 1 right now, which is really around introduction to the system. Module 2 will focus more on installation. It's a more technical module talking about installation and country customization. And that's where you'll probably hear a bit more about APIs and the upload formats and XMLs, etc.
All right, thank you, Sir Siddharth, and thank you, everyone. So we will be sharing the recording of this session so you can review them. Thank you, everyone. Good night.
Thanks, everyone, and see you next week.